contractual obligations that escalate with the number of people who are served through Medicaid, or trying to anticipate the effect with rate changes on cost settlements and other parts of the budget. So there has been a lot of progress made there. And then certainly it would be remiss not to mention tremendous investment of state dollars have gone into the Medicaid budget. We have presented a number of times in a historic sense that from the current biennium to the previous one before this session, because I haven't updated my middle slide yet, there was a $500 million investment of state money to shore up for both services, for growth in the program, and errors in how the federal shares were calculated in this budget. So in that regard, I think there's been made a lot of progress. I certainly know I would not want to weigh in on the debate that has occurred with this body about what the current year ending balance necessarily means just yet, because I think that will certainly evolve over time. But ending with a positive number, normally we would say that is fabulous. I think that we're hoping that what that reflects is the adequacy of the budget to support the ongoing needs, and it just remains to be seen if some or any portion of that is attributable to the timing of payments that might be coming from the Medicaid budget.
Chairman Nice.
Thank you, Mr. Chairman. I don't want you to wade in, but we might get our toes in that water just a little bit in those questions. Two of the areas that, as we were going through the budget process, that we spent a lot of time on the payment backlog to providers. I know we had our staff here calling every hospital in the state, every hospital sitting in the amount that they were, and as we went through July, continuing that process, and then looking at applications, getting the reports from every county out there, how many backlogs they have, how many approved. Do you have any indication of how much of that work has continued once we finish the budget, and where we may think those two numbers may be at this point?
Senator Heiss, I've had some conversation, and it has really not been note-taking, and for the record, with the department. I know that the hospital survey work has been done by Joe Cooper, and the department's CIO. I couldn't tell you the status of what has been updated since this committee was last reported. I have not seen an update of the status of that, and in terms of any sense of where that stands, it's my understanding, at least what those of us who are external to the department seem to have at this point to look at is what do we see in terms of changes in payments going out through the check write, and we know that's inadequate because we know that without knowing what's the composition of those payments in terms of data service and whether we're seeing more payments for data services that are farther back than what we'd see in a normal period. So I think I would have to defer to the department on specifics of what they might have done in terms of surveys to providers or further trying to, beyond what the check writes tell us. And the check writes are telling us we're running kind of where we were last year. So it would not indicate that anything has broken loose or changed. But whether or not that's an indicator that a backlog's been cleared, I don't know that answer.
And let me follow up with just kind of looking at that. If expenditures came into this year because they've been backlogged into a system, hospital billed for something in December and we still not got it worked out, and finally they get it worked out and get it paid. Is there a point for forecasting in the future that we go back and apply that to this year's budget, or will it always show up as an expenditure on next year's budget? Because my concern is when you're trying to build forecasts out in the year, if you shift payments from one year to the other, you drop down this year's, you increase the next year's, and you're showing an escalation that never really existed. And as you forecast that out in future years, that's a problem. So is there a time point that you go back to the budget and readjust costs back to the year they should have been expended?
Senator Heiss, we've had we're starting the conversation with the department, and we have specifically had some conversations with Rudy Demling, who is leading up that effort for the Division of Medical Assistance. What we've talked about is the need to normalize the numbers. We recognize that if we can't differentiate what should have occurred in the prior year and take it out of this year, we cannot create an appropriate baseline for going forward, not just for policy changes, but for those enrollment and backlog numbers. We are expecting that the department is developing some sort of reporting mechanism or methodology so that it can be demonstrated what the effect is of backlog claims and the timing of claims payments, so that the baseline, which is this year, used to forecast growth and enrollment and utilization change for the biennium going forward, would adjust for those numbers. And again, at this point, there is not enough information. I don't think that the agency is far enough along with doing that kind of data normalizing to tell us that just yet. Also, I would point out that in the Medicaid risk reserve appropriation, the General Assembly spelled out, it's a very effective list that would help to be able to pinpoint the very thing that you have suggested. And I think in our conversation with the department, we have suggested that whether or not there is the need to access the risk reserve, we believe from a budget management perspective and forecasting perspective, so that we can all have good data, it's important to have those elements defined, whether we use the risk reserve or not.
Representative Avila?
Thank you, Mr. Chairman. Based on Senator Heiss's question, mine has to do with the off-budget items for a long time sort of obscured the basic interest in the trajectory of the claims growth. Are we seeing a path there yet where we could see where it's been going and how it's going to be continuing, or are we going to have to clean up all of this backlog and everything to really get a clear picture on exactly what our growth rate is and projection of what it will be?
Representative Avila, I think, yes, I think that we need to clean up the data and have a pretty good idea. Right now, what we have is just sort of information, and without that, knowing how the data payment, data service data payment, whether or not we're seeing expenses last year that were for the previous year or in this year for last year. We certainly have historic information on trend, information that the department for a number of years has had and developed and managed. The biggest challenge is all of last year, and at least for the early, we're only 2 months into this year, has been sort of, we're missing that, we're missing cleansed data and normalized data for this year to do what you're saying, to be able to develop those trends.
Follow-up. At what point do we know this is the data? And there isn't this nebulous, we're not quite sure because of backlog or whatever. Where are we at the point that we can look and say this is definite data and we know what our trend has been and this is the fact?
Mm-hmm. Well, I think the two areas we've had the problem are the two biggies, right? Are the claims payments and the enrollment. And I would have to defer for more detail to the Department of Health and Human Services. At this point in time, I understand that the taxonomy issues, that is the classification of the payments, that the taxonomy issues that were resident in the NC Track system, and I hope someone will nod or say, that those have been addressed for the current year. We met this week and we were assured that the taxonomy issues and the data that we're seeing this year should have had those taxonomy issues resolved, and the department is still working on data remediation at the category of service level for the claims data that's in the NC Track system for last year. So on the claims payment side, I believe that work is ongoing, and I would certainly encourage that the department perhaps could even add more specificity or correct if I have misrepresented anything in that answer. And then The other thing is the enrollment data, and I think that that has been more forthcoming recently as they've worked out the kinks of connecting EIS data to TRACS data and trying to be able to smooth out some of the differences in the point-in-time counts.
Senator Torr?
Thank you, Mr. Chair. I'm probably going to bore everybody because these are going to be really rudimentary questions because I'm a little slow in trying to learn this. If you go to page 4, just real quickly help me. Are the numbers that follow each of the categories, are those budget codes for the divisions?
Yes, sir.
All right, so I'm on track. That's good. For the budget codes, do these tick and tack and foot and map to GL account numbers?
No, sir. No. These are numbers that, they're really old, but anyway, they go back to the old departmental accounting system, and they are the identifiers that were established to, and there's it's sort of code language, but 4.4 is the Department of Health and Human Services and so forth.
A follow on then, do we have anything that foots budget numbers to the actual financials so we can map across and track?
Oh, well, okay, budget, I answered the question maybe too narrowly. This does put back. These are the budgets in the accounting system. They use company numbers, not budget code numbers. Budget code numbers are what we budget people talk about. But this is directly out of the accounting system, and this is for the entity that is established, has a legal establishment and an authority for each one of those divisions up there. So it is tied directly to the financial systems information.
Great, then one last follow-up if I may. What's the last year or frequency we've had an independent third-party audit of the department?
I do not know that answer, sir. I'm sorry.
And politely, that scares the world out of me.
Yes, sir. And I'm racking my brain as I'm sitting here thinking about your question. I know that the state auditor has done a number of audits, but it is different, and it's been on either particular performance audits or segments of the financial operations of the department.
One last, if I may, more of a comment. This would be for everybody in this room. Why in the world do we not have, in some frequency, independent financial audits? I mean, that makes no sense. But
Senator Robinson?
Thank you, Mr. Chair. Pam, thank you for this comprehensive report, and I appreciate it. I'd say that I'm really glad to hear that the end of the year to the positive, but I still have some concerns. If we look on page 8 and we have documented encumbrances, I still wonder if we can track mental health liabilities. And then we know that we had questions about provider payments that were outstanding and all of that. Why don't we have some kind of forecast in here in terms of what are liabilities in terms of Medicaid? I don't understand that we wouldn't have some outstanding encumbrances from that department. I mean, is there no information in terms of what we owe that year in that area? Because we discussed a lot of those in this committee. And while I know that we're working on a system in terms of enrollment data, et cetera, we did have a lot of information in terms of providers who were not paid. I mean, they were not paid across the state. And so I'm extremely concerned. And I know that, going forward, we can care of them, we can put them in next year's budget, pay them then. But at year end, we need some indication, especially if we're talking about going to a system that's really going to give us clean data. And I want clean data. I want us to end up to the positive too. But I don't want us to be fooled that we ended up looking real good, yet we have a lot of providers across our state who say, well, hey, I don't have, I didn't get any money for thousands of claims or whatever. Is there no information that you have or no way to track what's out there?
Senator, I think that in the CAFR reporting, I think that the agency has the ability to generally predict services. There's always a lag between a service being provided and a service being billed to the Medicaid program. And because we're on a cash basis, this is what our financial records are reflecting on a cash basis. The comprehensive annual financial report will look more at that level of obligation. But I think if I'm understanding your concern correctly, it is that while there's a normal timing difference between when a provider provides a service and fairly promptly bills that service and gets reimbursed through the Medicaid agency, what we've got is a lack of visibility into claims that either have been billed and denied, and whether those have been denied correctly, whether there's any barrier in claims being billed and not being reflected in those obligations. And I frankly don't have an answer as to how to deal with claims that aren't being recorded